We all want to take good care of our health. After all, your body is the only permanent home you'll ever have. Eating well and exercising regularly are essential steps. But here's the question. Are you actually listening to what your body is trying to tell you? Our bodies are incredibly intelligent systems. They often send subtle or unusual warning signs long before major health issues develop. Unfortunately, these signs are often so strange or easy to overlook that we don't recognize them until it's too late. Well, that changes today. In this video, we're breaking down some of the strangest, most unexpected ways your body might be warning you that something's wrong. Some of these might surprise you. So stick with us all the way to the end, as number 18 will surprise you. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. You really don't want to miss what's coming next. Number 1, sudden changes in your handwriting. Sure, our handwriting evolves over time, especially from childhood to adulthood. But when you notice an unusual or abrupt change in how you write, especially if your letters suddenly become smaller and more crowded together, this could be an early neurological warning sign. One of the first symptoms of Parkinson's disease isn't always the tremors you hear about. It can actually begin with micrographia, a condition where your handwriting becomes tiny, cramped, and hard to read. Why does this happen? Parkinson's affects the dopamine-producing neurons in your brain, leading to muscle stiffness and reduced motor control. As these symptoms set in, they begin to influence your fine motor skills, like writing. So if you or someone you know starts writing in a way that looks dramatically different, especially smaller and more compressed, it's worth speaking with a neurologist. Number 2, diagonal earlobe creases. Take a quick look at your earlobes. Do you see a diagonal crease or line running from the ear canal to the lower edge of the lobe? While this might seem like just a harmless skin fold, some studies suggest otherwise. Multiple medical studies, including one from 2015 and another from 2016, have linked earlobe creases, particularly bilateral creases on both ears, to an increased risk of coronary heart disease. This phenomenon is known as Frank's sign, and while it's not definitive, it's considered a possible external indicator of underlying cardiovascular issues. Researchers believe these creases might be related to reduced blood supply to the earlobe, which may mirror what's happening in the smaller blood vessels of the heart. So if you've noticed these creases forming, especially in both ears, it's a good idea to get a cardiovascular checkup. Number 3, unexplained expansion of your waistline. Many people struggle with weight loss or gain, but if you're experiencing a rapid increase in abdominal size, particularly if you're sticking to a healthy diet and exercising consistently, this could signal something more serious than just belly fat. Unexplained belly bloating or weight gain can be due to fluid retention, a condition known as ascites, which may be linked to heart failure, liver disease, or even kidney dysfunction. In these cases, the body begins to retain fluid in the abdominal cavity, which leads to visible swelling of the stomach area, often without other typical weight gain symptoms. So if you're living a healthy lifestyle but your belly keeps expanding, don't ignore it. This could be your body's way of alerting you to organ dysfunction, and it warrants a doctor's evaluation. Number 4, damaged teeth without obvious cause. If your teeth are wearing down or becoming sensitive, and you haven't been overdoing the sugary sodas, acid reflux might be the hidden culprit. Even without noticeable heartburn, you might be experiencing what's called silent reflux or laryngopharyngeal reflux, LPR. This condition causes stomach acid to backflow into the throat and mouth, slowly eroding tooth enamel. Other signs of silent reflux may include a chronic sore throat, frequent coughing, a sour taste in your mouth. Unchecked, this condition doesn't just damage your teeth. It can also lead to more serious gastrointestinal complications, including Barrett's esophagus and even esophageal cancer. If you're experiencing dental issues without a clear cause, ask your dentist or physician about reflux screening. Number 5, a craving to chew ice. Craving ice cubes might seem harmless, maybe even refreshing on a hot day. But if you're constantly craving ice or chewing it habitually, it could be your body signaling iron deficiency anemia. This behavior is a form of pica, a condition where people crave and chew substances with no nutritional value, such as dirt, clay, or in this case, ice. According to a 2014 study, chewing ice may temporarily improve alertness in people with iron deficiency. Why? Researchers believe chewing ice stimulates blood flow to the brain, which may help counteract the fatigue and cognitive fog caused by anemia. Low iron means less oxygen-carrying capacity in your blood, and the brain notices. Instead of chewing ice, consider boosting your iron intake with foods like red meat, lentils, spinach, fortified cereals. If you're frequently chewing ice, ask your doctor for a simple blood test to check your iron levels. Number 6. Unexplained pain in your jaw, shoulder, or back. Sure, muscle soreness after an intense workout session is perfectly normal. But if you're suddenly experiencing pain in your jaw, shoulders, or upper back without any physical exertion, it could be a subtle signal your body is sending, one you should never ignore. These types of pains are sometimes referred pain, which means the discomfort originates from a different location in the body, such as your heart. This is especially important if the pain is dull, persistent, or comes on with other symptoms like shortness of breath, fatigue, or chest tightness. These may point toward a serious condition like angina or even an impending heart attack. Women, in particular, are more likely to experience these atypical heart attack symptoms. So if this pain seems unusual or unexplained, it's time to get checked. Your heart might be asking for help. Number 7. White vertical lines on your fingernails. A few tiny white spots on your nails? That's usually nothing, maybe the result of minor trauma. But take a closer look. Do you see vertical white lines or pale ridges running along the length of your fingernails? If so, this could be much more than just a cosmetic issue. These white lines, sometimes called Muir's lines, may be linked to underlying problems with your kidneys or liver. They can indicate protein deficiency or reduced kidney function, and in some cases, they're an early indicator of chronic disease. If your nails are also becoming unusually ridged, discolored, or sunken in shape, it's worth having your doctor run a few basic tests to rule out issues with your internal organs. Number 8. Persistent hemorrhoids that won't heal. Nobody likes to talk about hemorrhoids, but chronic or stubborn ones that don't respond to over-the-counter treatments could be a bigger red flag. While hemorrhoids are typically caused by pressure during bowel movements or prolonged sitting, if they persist, they may be misdiagnosed symptoms of something more serious, like Crohn's disease, a chronic inflammatory condition of the digestive tract. Left unchecked, Crohn's can lead to painful anal fissures, bowel obstruction, or even increase your risk for colorectal cancer. If your hemorrhoids frequently return, cause severe discomfort, or bleed often, it's essential to consult a gastroenterologist. Your digestive health could be under attack. Number 9. Constant cravings for salty foods. Craving something salty every now and then is common. But if you're constantly reaching for chips, salted nuts, or adding extra salt to every meal, it may signal a deeper issue. Persistent salt cravings are often linked to adrenal insufficiency, also known as Addison's disease. This condition affects the adrenal glands, which produce hormones that regulate blood pressure, metabolism, and electrolyte balance. Low levels of aldosterone, one of these hormones, can cause the body to lose sodium, making you crave more salt. If you're experiencing fatigue, muscle weakness, low blood pressure, or unexplained abdominal pain along with salt cravings, don't just chalk it up to a preference. It's time to get tested. Number 10. Hearing trouble that isn't age-related. Most of us expect some hearing loss as we age, especially if we've worked in loud environments or skipped the earplugs at concerts. But if your hearing seems to be fading earlier than expected, or without a clear cause, it may be more than just age. According to a study published in 2010, there is a surprising connection between hearing loss and chronic kidney disease. The kidneys and inner ear share similar structural and physiological characteristics, so when your kidneys aren't functioning properly, it can affect your hearing as well. This type of hearing loss isn't just a natural part of aging, it's a medical clue. If your hearing is deteriorating and you're also experiencing swelling, fatigue, or changes in urination, ask your doctor about getting your kidney function tested. Number 11. Sudden, uncontrollable emotional outbursts. Have you ever found yourself laughing or crying uncontrollably for no reason, and you couldn't stop even if you tried? This might not be an emotional issue. It could be a neurological one. This phenomenon is known as pseudobulbar effect, PBA, a condition where your brain's ability to control emotional expression is disrupted. It's commonly linked to neurological disorders, and one of the most frequent culprits is multiple sclerosis, MS. Research shows that PBA affects up to 10% or more of people living with MS. If these emotional outbursts are happening often and feel out of proportion to your actual feelings, it's a sign that your nervous system might need attention. Number 12. Ear pain after eating a large or spicy meal. It sounds odd, but if your ears ache after you've eaten a big meal, or a particularly spicy one, it might not be your ears at all. This could be a sign of gastroesophageal reflux disease, GERD, especially if it happens frequently. The reason? The vagus nerve connects your stomach to many parts of your body, including your ears. When stomach acid irritates this nerve, especially during reflux episodes, it can refer that discomfort to your ears. So if you feel ear pain shortly after eating, especially alongside symptoms like bloating, indigestion, or a chronic cough, it's worth investigating. GERD can exist without classic heartburn, and if untreated, may lead to complications like esophagitis or Barrett's esophagus. Dietary changes and medications can often help calm things down. Number 13. You're constantly running to the bathroom. Needing to pee frequently can seem harmless. Maybe you just drank a lot of water. But if you're heading to the restroom every 10 to 20 minutes, even when your fluid intake is normal, your body might be sending you a warning signal. One of the most common medical reasons behind excessive urination is diabetes, either prediabetes or full-blown type 1 or type 2. When your blood sugar is too high, your kidneys work overtime to filter out the excess glucose. That process draws more water from your body, which in turn leads to frequent trips to the bathroom. For reference, healthcare professionals say urinating around 6 to 7 times per day is considered normal for a healthy adult. If you're going significantly more than that, and especially if you feel constant thirst or fatigue, it's worth checking your blood sugar levels. Of course, frequent urination can also have other causes. If you're pregnant, for example, the growing uterus can press against the bladder, leading to more frequent bathroom visits, which is totally normal. But if pregnancy isn't the reason, you should also consider urinary tract infections, UTIs, or overactive bladder syndrome as possibilities. Bottom line, if it's disrupting your sleep, your daily routine, or feels excessive, speak to a healthcare provider. Your kidneys, hormones, or urinary system could be trying to tell you something. Number 14, you're losing weight without trying. You step on the scale and notice you've lost several pounds without dieting or exercising more. Sounds like a dream, right? Not necessarily. Unintentional or unexplained weight loss, especially when it's more than 5% of your body weight over a short period, can be a major red flag. While it could be due to stress or temporary illness, it may also signal something more serious happening inside your body. One potential cause is a metabolic disorder, such as hyperthyroidism, where the thyroid gland produces too much hormone, speeding up your metabolism and burning calories rapidly. Another possibility is an autoimmune disease, like celiac disease or Crohn's disease, where your body attacks itself and disrupts nutrient absorption. But perhaps most concerning, unexplained weight loss is often one of the first visible signs of cancer. In women, ovarian cancer can lead to sudden weight loss along with bloating or abdominal discomfort. In both men and women, cancers of the pancreas, stomach, esophagus, and even lungs may also result in a decrease in appetite, changes in digestion, and weight loss. If you notice your clothes fitting looser and there's no clear reason why, don't brush it off, especially if it's accompanied by fatigue, digestive issues, or pain. Early diagnosis can make a huge difference. Number 15. Your skin is itchy for no clear reason. Everyone gets itchy sometimes. Maybe it's dry weather, a bug bite, or new laundry detergent. But if you find yourself constantly scratching, especially at night, and there's no visible rash or allergy, this could point to something deeper. Persistent, unexplained itchiness is sometimes linked to liver problems. When your liver isn't functioning properly, bile can build up in the body. This can irritate nerve endings in your skin, causing a sensation of itchiness, even if your skin looks completely normal. Conditions like cholestasis, cirrhosis, or hepatitis can trigger this response. Itching caused by liver issues often starts in the hands and feet and then spreads. It might get worse at night and doesn't improve with lotions or topical creams. Other potential culprits include kidney disease, thyroid problems, or even certain cancers like lymphoma. So if you've been scratching more than usual and over-the-counter remedies don't help, don't ignore it. Talk to your doctor and get your liver function tested. Number 16. Your breath smells fruity or like ammonia. Bad breath can be embarrassing. But did you know it can be a sign of a serious internal issue? A fruity or sweet-smelling breath is a common warning sign of diabetic ketoacidosis, a life-threatening complication of uncontrolled diabetes. This happens when your body starts breaking down fat too quickly, producing acids called ketones, which spill into your bloodstream and even show up in your breath. On the other hand, if your breath smells like ammonia or urine, it could be a sign of kidney disease. As your kidneys start to fail, toxins build up in your body and can give your breath a distinctly chemical odor. If your oral hygiene is good but your breath still smells strange, don't just reach for the mints. Get a full medical checkup. Number 17. Your eyes look yellow. Look in the mirror and check the whites of your eyes. Do they appear yellow instead of bright white? This condition is known as jaundice, and it's a signal your liver may be in trouble. Jaundice is caused by a buildup of bilirubin, a yellow pigment that forms when red blood cells break down. Normally, your liver filters it out, but when the liver is damaged or inflamed, bilirubin accumulates, turning the skin and eyes yellow. Common liver-related conditions include hepatitis, liver cirrhosis, bile duct obstruction, or even pancreatic cancer. If you spot yellowing in your eyes or skin, it's not something to shrug off. Get your liver enzymes checked as soon as possible. Number 18. You're losing hair rapidly. Losing a few strands of hair every day is perfectly normal. But if you're noticing clumps of hair in the shower drain, on your pillow, or your hairbrush, it could be a red flag. Sudden or excessive hair loss can be a symptom of hormonal imbalances, especially low thyroid hormone levels, hypothyroidism. Your thyroid regulates many metabolic functions, including hair growth. It may also indicate iron deficiency, autoimmune disorders like alopecia areata, or even chronic stress, which pushes hair follicles into a resting phase. In rare cases, rapid hair loss can be tied to lupus, polycystic ovary syndrome, PCOS, or side effects of medications such as chemotherapy drugs or anticoagulants. If your hair is thinning and it's not due to aging or genetics, it's time to investigate. Number 19. You feel numbness or tingling in your extremities. That pins and needles feeling when your foot falls asleep usually goes away quickly. But persistent or unexplained numbness and tingling, especially in your hands, feet, arms, or legs, could be a warning sign of nerve damage. This symptom is often associated with diabetes, which can damage the peripheral nerves over time, a condition known as diabetic neuropathy. It can also be a red flag for multiple sclerosis, MS, vitamin B12 deficiency, stroke, or even spinal cord issues like herniated discs. If these sensations happen frequently, especially with weakness or trouble with coordination, don't ignore them. Early treatment can prevent further nerve damage and improve outcomes. Your body is always talking to you. But are you really listening? From jaw pain to itchy skin, from salty cravings to yellowing eyes. These aren't just random quirks. They're signals, warnings, clues from deep within. If something feels off, don't brush it aside. Early detection can be the difference between prevention and progression. So if you recognized any of these signs today, take action. Talk to your doctor. Get checked. Protect your health. It's the greatest asset you have. And if you found this video helpful, don't forget to like, subscribe, and share it with someone you care about. Hit the notification bell so you never miss a life-saving tip. And hey, drop us a comment below. Have you ever experienced any of these strange symptoms? Your story could help someone else. Thanks for watching. Until next time, take care of your body. It's the only home you truly have.